The subcommittee will come to order. Today, the Subcommittee for Surface Transportation, Maritime, Freight, and Ports will examine the roadway safety crisis and the solutions that we must implement in response. I would certainly like to thank my ranking member, Senator Young, as well as Chair Cantwell and Ranking Member Cruz for their help in convening this very important hearing. Every day, unfortunately, more than 100 Americans lose their lives on our roads. If trends continue, we expect more than 40,000 fatalities this year and hundreds of thousands of serious injuries. That means thousands of families are going to be torn apart by preventable crashes. Those families deserve our recognition as we work to address this problem. And that's why I'd like to enter into the record statements made by victims' families who have written to this committee to urge for further action on roadway safety. And without objection, those letters will be entered into the record. I also dedicate today's discussion to them, as these families know all too well the safety situation on our roads constitutes a national crisis. In 2021, the National Highway Safety Traffic Administration estimated that the U.S. had the highest number of fatalities since 2005. Unfortunately, the trend has not significantly improved over the past 2 years. According to NHTSA's most recent estimates, roadway deaths remain elevated, with only a 3% reduction in 2023. These numbers do not reflect the harm done to our drivers and passengers, but also vulnerable pedestrians, bicyclists, and motorcyclists who continue to be disproportionately harmed on our roads. Also overrepresented in these tragedies are Black, Hispanic, and Native Americans, as well as Americans living in rural areas. We need a strong and comprehensive response, and today we'll discuss a holistic, safe systems approach to addressing the roadway safety crisis and how we can implement that approach all across our country. The Safe Systems approach ensures that all aspects of our roadways account for inevitable human error. It emphasizes building multiple layers of protection so that even when mistakes are made, death and injury are unlikely. This framework focuses on 5 key categories: safer people and behaviors, safer vehicles, safer speeds, safer roads, and improving the post-crash care. I believe emerging technologies are going to play an important role in this endeavor. New interventions, from digital infrastructure that improves crash response to predictive road maintenance and active traffic management, are absolutely essential to achieving safe system goals. That also includes the safe and accountable development, testing, and deployment of autonomous vehicles, which can help us reduce serious injuries and death on our roadways. I expect our witnesses today to discuss the principles and data behind the Safe Systems approach, as well as how we can better support communities implementing these solutions on the ground. We have already made important progress. Congress took one key step towards supporting roadway safety with the passage of the Bipartisan Infrastructure Law in 2021. The law provides $5 billion in safe streets for all grants for local, regional, and tribal communities to prevent roadway deaths and injuries using a safe systems approach, and requires them to measure their success along the way. The Bipartisan Infrastructure Law is also the first piece of legislation to establish requirements for complete street standards. These ensure that our roadways can safely accommodate all traffic. That includes vulnerable road users like pedestrians, bicyclists, motorcyclists, and people with disabilities, as well as the elderly. And finally, with the help of Michigander Rana Abbas Taylor, the Bipartisan Infrastructure Law included the Honoring the Abbas Family Legacy to Terminate Drunk Driving Act, a requirement for the inclusion of impaired driving prevention technology in our vehicles. Today, we will learn more about the challenges and the opportunities these provisions are posing for communities on the ground. But the Bipartisan Infrastructure Law was just the beginning. There's still so much more that we can and we must do in order to address this crisis. Our witnesses will also help us examine what solutions need to come next. I would like to thank each of you for being here today and for the expertise that you're going to share with this committee and for all you do each and every day to make our streets and our highways safer. Mr. Krasenstein, I want to thank you again for being here, and also thank you for all the great work that you're doing in the city of Detroit. But as you mentioned in your opening comments, unfortunately, Detroit has historically struggled with high numbers of roadway injuries and deaths, especially among the Black community. So my question for you, sir, is can you speak to the importance of Safe Streets for All funding in the city of Detroit in terms of enabling various safety interventions that would otherwise not simply be possible? And two, can you speak to how Detroit is addressing some of the socioeconomic and racial disparities in roadway safety using this grant program?
Thank you for that question, Chairman. So for the first part of the question on the importance of the Safe Streets for All program, the program is vitally important for cities like Detroit, where within the city limits, we have 3,100 linear miles of road, some of which are under our jurisdiction, but many of our larger roads, our most dangerous roads, are not. The Safe Streets for All program gives us a dedicated funding stream that we don't need to worry about making the hard choices between state of good repair and saving lives on safety projects. This gives us the opportunity to have dedicated funding to just focus on safety on streets that have been overbuilt in Detroit and, frankly, have had way too many crashes, injuries, and fatalities. To the second part of your question, Chairman, on how we're addressing socioeconomic factors into this, that's frequent in all the work that we do on everything from which roads that we pave to where we do safety projects and handle interventions. We're proud to be taking a very equity-based approach across both our public works teams and our planning and development teams and how we engage neighborhood groups, looking at commercial corridors and looking at the data as well. So we do try to take a very balanced approach with where we make those types of investments throughout the city.
Right, thank you. Ms. Chase, in addition to serving as chair of this subcommittee, I'm also the founder and chair of the Senate Motorcycle Caucus. I'm an avid motorcyclist myself and share that with a number of my colleagues here. May is also Motorcycle Safety Month, where we raise awareness of motorcycle fatalities. Motorcyclists unfortunately perish on our roads at a rate 22 times the rate of motor vehicle occupants. So my question for you is, what sort of technology interventions are most likely to benefit motorcyclists as well as other vulnerable road users, and how can we get those up and running as quickly as possible?
Thank you for the question, Chairman. Probably the most effective safety technology would be vehicle-to-everything technologies, V2X technologies for motorcyclists. These technologies, as you know, provide situational awareness to both drivers of cars, motorcyclists, and other road users to alert them, the drivers or the users of the vehicles, of impending collisions or hazards that go beyond their line of sight so that the drivers can make better decisions, avoid a crash, and improve safety on the roads. And this is really critical when you're talking about motorcyclists or other road users, who do not have the protection of a vehicle. So I would say vehicle-to-everything technologies would be the top technology solution. There are also technology solutions being developed by BMW and Bosch, who are very active in the motorcycle safety space with what we call networked VDEX and digital alerting. So alerting of maybe other key information about the roadway conditions or weather, things that wouldn't essentially be a safety of life issue, but could be really critical information to a motorcyclist or a cyclist. And so those solutions are being developed by those companies. And in addition, the American Motorcyclists Association was a part and has been a part of a larger VDEX coalition for many years now, supporting scale deployment of these technologies so that we can, in fact, protect not only drivers, but also motorcyclists, bicyclists, and other vulnerable road users using our system.
Great. Thank you. Mr. Farah, as you know, I strongly believe and support AVs and believe that they can play a major role in achieving our goals of preventing roadway fatalities, and I appreciate you mentioning the bill that I'm working on with Senator Thune. But in order for that to be the case, self-driving vehicles and their developers need to gain and keep public trust, as you mentioned, and the acceptance and ensure that there's also a transition for affected workers with this new technology. The committee is in receipt of some letters from unions representing workers who work in and around vehicles that share their priorities and concerns with self-driving cars. Without objection, I will be entering those into the record. But Mr. Farrar, how are you and your members working with transportation workers, affected communities, and the public to build trust and transparency? And what do you think the best approach is to dealing with this challenge as this industry continues to develop? And unfortunately, incidents will inevitably occur, but and something you need to be thinking about.
Senator, thank you very much for the question. I appreciate, again, your leadership. As I mentioned in my opening statement, a recent industry initiative of AVIA was the release of our trust principles. And one of the things that really comes through in that document is that we are articulating our very strong belief that we need to have an incredible amount of local engagement. This means prior to companies going into cities, speaking with local leaders, with law enforcement, with with first responders, with leaders, whether in labor and in other walks of life. It's very important that we be meeting people where they are, explaining what our intentions are, how it is that we can increase safety, how it is that we can help with supply chain challenges, how we can assist especially city leaders with accessibility opportunities and whatnot. And so this very, very localized operation is something that we're very proud of, and it's something that the industry has devoted a significant amount of resources toward.
President Stein and Mr. Nelson, I've got a question for both of you. If each of you could speak to potential improvements that you think we can make to the Safe Streets for All grant program to improve our community's ability to make the most of them. They've been out, but love to have your input as to how we can make them better. We'll start with you, Mr. Nelson.
Thank you for the question, Senator. One of the benefits of the SS4A grant program is that it targets communities. And one of the benefits of that is that if we're really serious about driving the number of highway fatalities in the nation closer to zero, we need to follow the fatality data. And it's going to tell a story pretty quickly that it's predominantly in lower income, underserved communities. One of the benefits of bringing these kinds of funds to the local community is addressing the very population that is bearing the predominant brunt of the highway safety problem. One of the ways that we can improve the SS4A grant is by improving the requirements on states and localities to engage in public engagement and participation. And so this is more than just a listening session of local residents. It's more about making sure that they understand what the safety experience is in their community, that they understand what the various infrastructure countermeasure solutions are available to them and the considerations relative to each, and that their input about which of those countermeasures they would welcome most into the community, I think should be adopted and implemented into sort of the outcome of that project. It's how we are going to build demand and support for these kinds of investments from the people who live in those communities, and we can foster more investment like this in the future.
Very good. Mr. President Stein?
Thank you for the question, Chairman. Well, to start, we are extremely supportive of the Safe Streets for All program and think that the current design for benefiting local governments is extremely important. So off the bat, we're very happy that the program exists. In terms of changes we would propose to make to the Safe Streets for All program going forward, a couple things come to mind. I think one of the big opportunities is how do we incentivize collaboration between cities and other road jurisdiction owners that may not be eligible to apply. So in my testimony, I talked a lot about the value of state DOTs and the larger roads that they own. Right now, state DOTs are not eligible to be able to participate in the Safe Streets for All program, and I think that's a good thing. But I think where we need to get really creative is, well, our state DOTs also own the most dangerous streets. So knowing that they're not eligible to apply and that there's still a match requirement where it's difficult for cities to justify spending its own dollars on someone else's roadway, I think we need to be really creative on how we address those larger arterial roads that right now fall outside of the purview of Safe Streets for All unless you're applying on behalf of another jurisdiction. The second area that I would look at is whether or not that there is, I would look carefully at the balance between implementation funding and the planning and demonstration project funding. I think both are incredibly valuable, but as more and more communities go forward and have safety action plans, I think it will be very important to have flexibility in how those planning and demonstration dollars can be spent to allow new safety countermeasures to be tried out, to be piloted before doing a full-scale project. So I think between two of those, I think there's opportunity to do a little fine tweaking to an otherwise overall great program.
Right, thank you. Dr. Sant, you are an epidemiologist by training, and in your testimony, you discussed taking a public health approach to roadway safety in order to improve outcomes. So if you could please describe exactly what you mean by a public health approach, and specifically when it comes to how we improve both data collection as well as education related to roadway safety.
Yes, thank you for that question. In public health, I think the approach is very compatible with what we've been talking about with the safe system approach. It means that we take a holistic and proactive approach to prevent and reduce the likelihood of risk of injury or any other negative health outcome. And another important parallel is that in public health, we follow what's known as the socio-ecological framework for much of our intervention development. And what that means is that we recognize that individual behaviors stem and often are influenced by a broader social environment and a broader environmental physical environment. And so we can change human health and human behavior by recognizing the systems in which the people are operating and looking at those social and physical environments. And so by the safe system approach, taking that holistic view, it's very much aligned with the approach that public health practitioners use for other health issues. With respect to your question around data, we see that the public health community offers tremendous resources and knowledge around how we can improve our injury data systems. There's a lot of complementary data sources from our health data sets, including our trauma registries, our emergency department data, our EMS data, that can really supplement the data that we collect from our law enforcement officers. We also see really great examples of timeliness in data collection within the public health community and opportunities to link that data and really understand the nature of our risks. And with respect to the question about communications, public health does a fantastic job in many ways of engaging the community and having really strong messaging around health communications and health behaviors. And so that's a really great opportunity to coordinate and build partnerships with the transportation community as well.